Welcome to the Population Health Management Podcast, brought to you by Lifeline Health Solutions. My name is Laurel Durr, and I will be your host for today's episode. So today I have our resident nurse, Jessica Scruton, with us again. She's here for our second care transformation focused episode. Seasonal Depression Awareness Month has begun, and in light of the colder, grayer weather, we think that it's an important topic to discuss. And according to Johns Hopkins, it affects approximately 10 to 20% of the entire population this time of year. But first, for new listeners, Jessica, can you touch on your background a little bit and your role as clinical transformation advisor here at Lightbeam?
Sure thing. Thanks for having me back again this month, Laurel. I work at Lightbeam as a clinical transformation advisor, so I'm specifically responsible for workflows, processes, solving complex challenges for the clients, utilizing the Lightbeam platform.
Your work here is incredible. Let me just say that. Everybody loves you here at Lightbeam. And we know how much it benefits our clients to have someone who's worked in the medical setting as a guide through care management implementation. As we mentioned before, December is Seasonal Depression Awareness Month, and seasonal affective disorder is very widespread, but many people know so little about it. So we wanted to share a little bit. What exactly is this disorder?
Thank you, Laurel, for the kind words. I love what I do here. I'm really lucky to work with some amazing clients. Yes, seasonal affective disorder is so important to discuss in the winter. It really is crazy if you think about it, that such a joyful time of year, there are people that are feeling at their lowest. There is scientific reason for this, seasonal depression, and why it develops in the winter. Usually it's due to the fact that there's less light for them to absorb. The daylight really does affect us more than we realize. In the wintertime, things are darker, colder, the days are shorter. So this lack of sunlight has a major impact on us as far as our mood goes, as well as cognitively. So our energy levels and our moods are really impacted by that. Side note, shift workers. So like if you have people that work in the hospital overnight, they experience seasonal affective disorder year round because they are up during the dark hours, sleeping during the light hours. So everything that we're talking about here and how it impacts you as far as depression impacts them on a regular basis because of that. So there's things that have been put into place for them specifically on how to kind of combat these symptoms on a daily basis to keep them from feeling depressed year round. A lot of it has to do with sun lamps and things like that.
Wow, I didn't know that.
Yeah.
So what exactly does melatonin do for us? Is it mainly to blame for seasonal depression?
So melatonin does play a part in the seasonal depression or seasonal affective disorder. Seasonal affective disorder, also known as SAD. There is a lot that goes into the seasonal affective disorder diagnoses and what's causing that. It is a type of depression. SAD, or seasonal affective disorder, is a type of depression. It's unknown the exact source of what is driving the seasonal depression, but a lot of the research shows that it's based on the fact that there is a lack of exposure to sunlight in the winter months. So the Mayo Clinic has a lot of research on this, and it shows that there's three areas that can be attributed to the cause of seasonal affective disorder. The first one is melatonin. So melatonin is a natural sleep hormone that we all create. The way that it works is as you have a decrease in exposure to sunlight, the body or your brain has a gland that triggers the production of the melatonin, and it is pushed into your bloodstream. And when it's pushed into your bloodstream, that's what gives us that groggy feeling when we're going to bed, that sleepy feeling we all know too well. The melatonin is, again, produced because of the lack of sunlight. So in the winter months, when we're looking at less exposure to the sun, shorter days, gray days, things like that, we don't necessarily stop the production of melatonin as quickly. So this leads to an overproduction, and that's where we get that feeling of fatigue throughout the day. So the other piece that they really look at when we're looking at seasonal affective disorder is serotonin. So serotonin is a neurotransmitter that affects our emotions and our moods. A decrease in the sunlight, again, causes a decrease in serotonin, which can really lead to those feelings of depression, hopelessness, and fatigue.
So, what are some symptoms of seasonal depression that people should pay attention to, both in themselves and in others this winter?
So the symptoms that you'll see of seasonal affective disorder are much like the same ones that you're going to see with major depression. The difference is the symptoms with SAD or seasonal affective disorder begin to fade away as things warm up and you have more exposure to the sun. If you do not, or you do not feel that they are beginning to fade as the winter months are winding down, then it's important that you seek proper channels of help. I also want to note that it's extremely important to understand if you have anybody that has a history of major depression, seasonal affective disorder needs to be taken very seriously. It can take such a toll on both your outlook and your physical state. And with a history of any sort of depression or mental illness, it leaves somebody much more vulnerable to the seasonal depression. So the symptoms that you look for, as I said, are going to look much like the ones that you would look at for major depression. Mood changes, so any changes in your mood, loss of interest in things that you enjoy, changes in your sleep pattern, not just oversleeping, but insomnia, not sleeping enough, a change in eating habits. A lot of people with seasonal affective disorder experience weight gain, a struggle to concentrate, or questioning of your self-worth. All of these are symptoms that do not need to be ignored. They need to be looked at, and it's super important to speak to someone if you're noticing that these are taking place. It's also important to understand that these are the symptoms that you would look for in yourself with seasonal affective disorder, but it's important that we pay attention to our friends, family, and colleagues, because sometimes it's easier to see them in others before we see them in ourselves.
Definitely. Those are all very important things that we should be paying attention to. So what would you say are some things that people can do to help fight off the winter blues this season?
We have to pay attention to our bodies. It's especially in a season in the winter, there's lots of holidays, lots of gatherings, and it's synonymous with being a season of overindulgence. Mm-hmm. So when you have yummy food around you all the time, it's hard not to overdo it, especially with the carbohydrates and the sugar. It's important to keep these things in moderation, as well as the alcohol. So everything, in moderation. Exercise remains important. 30 minutes of activity a day is the usual recommended amount of exercise. So keeping that activity level up. In Texas, we're pretty lucky here. We've got mild winters, and if there's not, I'm not going to say the thing about bundling up. We've got mild winters, and taking advantage of that as far as getting outside and getting fresh air and sunlight exposure. It's really important, especially when trying to combat some of those symptoms of seasonal depression that we know are driven by our lack of exposure to that sunlight. Moderation for eating and drinking, activity, and outside time.
Mm-hmm. I love that. Now, how do you think that we can tie addressing seasonal depression with value-based care practices? Can our clients leverage insights from their platform to create initiatives to help patients who may be struggling?
So absolutely, the clients can absolutely, use the insights from the platform to create initiatives. So the one thing to remember, and if you listened to the diabetes podcast, I think we mentioned this in that, mm-hmm. as far as really understanding the impact that behavioral health plays on people and how they take care of themselves. So, just a really easy way to explain that is if you have somebody that's suffering with depression, seasonal affective disorder, that is feeling to the point where getting out of bed feels like a chore, it's they're less likely to get up and do some of the things that they need to do in order to care for some of those chronic conditions. So the first thing that I really wanted to focus on with that is just know that there is a direct correlation between behavioral health and adherence to managing chronic conditions. Anything we can do to highlight the individuals that fall into those buckets and create programs or structured initiatives around those is going to be helpful for both the patients as well as the clients. Using the client's data and reviewing that information through the analytics portion of the Lightbeam platform can target a subset of that population. And what I mean by that is we can maybe look at a group of individuals that have a history of major depression or bipolar disorder, as well as look at their adherence to medications or labs that need to be drawn, and try and draw a line between their behaviors to manage the conditions and the ones that have the behavioral health issues. So identifying patients that are at risk by looking for the ones that are non-adherent, who have the history of mental health, will help us really be able to target a group of individuals that are struggling.
Jessica, thank you. It has been such a pleasure having you back with us again. Seasonal depression is a very serious topic, and we wanted to make sure to spread the word on its causes and what we can do to combat it. So next, I want to ask you some resources for our listeners who may need additional help.
So the biggest resource I can provide is that if you're experiencing any suicidal thoughts, any thoughts of self-harm, harming others, 911, you've got to call 911. There's also a suicide prevention hotline. Laurel, I think you'll share that with everybody as well.
Mm-hmm.
If you're looking for a mental health professional to speak with, ask around in your network, speak with your primary care doctor. They'll be able to give you a referral. A lot of companies have EAP programs. That's a good place to start if you're not in a crisis situation. Counselors that can be referred based off of your employee benefits is always a great benefit to have. So check with your employer and see if you have an EAP program.
Yeah, thank you. And like Jessica said, I will make sure to list the resources down below in the description box.